My name is Sarah Fryer and my major is physical therapy. This presentation will discuss what I've learned in Health Science 410 and how I will apply it to my career as a physical therapist. The aging population is growing, and so is their need for healthcare. I've learned through this class that we as health professionals need to be aware of customs and traditions of cultures different from our own, that the cost of living after retirement is steep and it may be difficult to afford, that part of healthy aging is keeping a steady social network, and that there are innumerable opportunities for older adults to stay socially active in Stevens Point, and that most older adults have a positive outlook on the life they've lived as well as their own aging process. There are many factors to consider when caring for someone from a different culture than our own. Minority elders may have less education, substandard housing, less money, and poorer health than the general population. It is also important to consider their ethnic background and any customs or beliefs that they may observe. As health professionals, we must be respectful of these factors and provide quality care regardless of any differences between their and our own situation. We must strive for a culturally competent and respectful healthcare system. I learned a lot about economics and the condition of the Social Security system through our lectures. Coming in, I had no idea how Medicare and Medicaid worked, or that funding for Social Security and insurance was dwindling to the extent that it is. Now I know that hospital and nursing home care is extremely expensive, and even with financial aid, many elders are not able to afford the care they need. I learned that there are different parts to Medicare, namely A, B, and C, and that depending on which part a person qualifies for, there are different levels of medical coverage that they will receive. I also learned that some nursing facilities have requirements regarding finances, such as the requirement that the patient show gains, otherwise Medicare will not cover their stay. Hospitals also require a 3-night stay before Medicare will cover their hospital care. We talked about many opportunities in the Stevens Point area that are available to older adults to keep them socially and physically active. There are facilities like the YMCA and the Lincoln Center that provide services like health education classes, driver's ed refresher courses, and group fitness classes. Other services including transportation, religious services, and social events are widespread throughout the Stevens Point community. It's easy to find out about these community events by contacting the facilities or looking online. Services like these decrease the risk of becoming lonely and depressed or becoming homebound. These services also make living alone or independently an option for someone who may not have been able to otherwise. Through our lectures and interviewing my grandfather, I realized that older adults generally see aging in a positive light. This is contrary to my previous understanding that aging is something to be dreaded and staved off for as long as possible. Things that contribute to this positive attitude include a lifetime of experience and knowledge, a support network of family and friends, and the feeling of a fulfilled life. I also learned that many older adults do not feel mentally as old as their chronological age. So now that I have the knowledge about caring for the elderly, I plan to put it to good use. The underlying message of caring for anyone, old or young, is put the patient first. Putting an elderly patient first includes the cultural competency I mentioned before, respecting their beliefs, customs, and day-to-day state of mind, and making sure that the patient knows and understands exactly what I'm doing to care for them. To be culturally competent, I will need to ask questions of my patients so as not to offend them. I may need to do some research on my own about the best way to interact with someone from a different culture than mine, and observe their customs as if they were my own. Along with being aware of the cultural backgrounds of my patients, I may need to make special accommodations based on their religion or beliefs. This idea overlaps with the next thing I will discuss, which is respecting my patient. I will respect the culture and beliefs of my patient by being non-judgmental and accepting. I will also respect my patient's attitude towards their care, myself, or other healthcare workers they interact with. I will respect their day-to-day outlook because I know, as well as anyone else, that we have good days and bad days. I will be polite and positive when interacting with a patient, regardless of their demeanor. All of these aspects of respecting my patients fit the mantra of putting the patient first. Another way that I will ensure quality care and put the patient first is by fully explaining myself about their care. Sometimes it's hard to remember that not everybody understands medical words, so when I explain a procedure or exercise, I may have to use terms or analogies that my patient will understand. I will have to realize that not everyone is as literate as I am, and that I may need to take that into consideration and make accommodations for them in that way. Ensuring that my patients fully understand the care they receive will be an important part of patient-centered care. I have learned a lot about caring for the aging population. Putting the patient first and being non-judgmental are themes that resonate through all the aspects of our discussions in class. When I am caring for patients as a health professional, I will make these themes the center of my practice and encourage my peers to do the same.